He's watching. Hi, good afternoon, everyone. Welcome to our Facebook Live talk today. Thank you so much for joining. Don't forget today, the topic today we're going to talk about is nutrition in pregnancy. So if you have anybody who is pregnant, you have anybody who is about to be pregnant, or just anyone who's interested in this topic, pick up your phone, either call them or send a message to them to watch, or in case if they don't watch it now, you can always send the link later on. Okay, and then if there's any question, please post at the comment section, and we will get back to the question at the end of the session. Our speaker will answer it. Today we have with us Dato Dr. Niraj. He is an obstetrician and gynecologist and has been practicing for almost 20 years. He has trained in various government hospitals in Malaysia and in the United Kingdom before obtaining both MRCOG from London and MRCP from Ireland in 2007. He continued to work within the public service till 2010. Before venturing into private practice, he worked mainly in Shah Alam and did visiting consultations in various other private hospitals in Petaling Jaya. Before starting his session in Assunta Hospital, he has delivered an average about 60 to 80 babies per month while managing high-risk pregnancies with a team of dedicated staff. Wow. He has vast experience in operative procedures related to both pregnancies and gynecology surgeries. Along with that, he has a keen interest in fertility and metabolic issues among pregnant women. He developed a special interest in laparoscopic surgeries from benign gynecological disorders. He developed these skills in various hospitals he was attached to previously, including UK, Singapore, and Malaysia. He worked with multiple NGOs to run free clinics in rural areas and perform gynecological surgeries for these underprivileged patients. He is involved in teaching medical students at Management and Science University, which is MSU, and actively participates in training future specialists in Malaysia. He was a committee member of International Representative of Royal College of Obstetricians and Gynecologists from 2018 to 2021. He continues teaching postgraduate students and was involved in making Malaysia a venue for Part 3 RCOG examinations recently. He is one of the few in Malaysia elevated the Fellow of Royal College of Obstetricians and Gynecologists in 2020. He is pleasant and caring towards his patient and always strives to give them his best. We are honored to have today Dato Dr. Mohammed Niraj. Welcome, Doctor.
Right. Thank you, Shara, for the very kind introduction. So good afternoon, everyone. I must say this is the first Facebook Live, actually. Something really new to me. Now, today we're going to talk about nutrition in pregnancy, but we're going to start off with nutrition first. And I have been exploring this for the last couple of years. It's amazing what's out there, and so much of research has been done. Initially, a good friend of mine who is a doctor from Perth started talking about nutrition, and he was really devoted to what he was saying, and that got me intrigued, and I started reading up stuff and looking from fat diets to even the keto way of life. In pregnancy, there are so many new things out there, but not all of it actually really makes sense. So you need to be careful on what's out there. Yeah. I'm sure that most of you have been in a situation like this when there are, say, two people at the age of, say, 50. One of them is a really healthy individual who works out and eats very healthy diet and is trim and exercises every day. And the other person, again, at the age of 50, a bit unhealthy, a bit overweight, smokes and drinks, and bigger size than usual. And suddenly, at some point, the healthy 50-year-old falls ill, and everyone starts commenting, "Ayo, what happened to this? No point you sacrificing everything, and then getting ill like this. So there were people looking into further and trying to find clues on how this happened, going back to until way before when they were in the womb. And that's when this Barker's hypothesis came about, and also called fetal programming. And they found that how a mother lived or how the mother was during her pregnancy really determines how the baby grows up as an adult. And but if you really look at things, there are a lot of other um, factors that contribute to how your baby grows. Genetic plays a huge role, but so does environment, and environment where the child is growing, parenting, bonding, and lifestyle of the child. So a big part of this is actually what we call as fetal programming. Now, how this works, there's a saying in English that you are what you eat. So, and a food high in processed ingredients or sugars can cause a magnitude of risk to you. So, we we looked at things in many different ways. So, now in the first few months of the baby's life in the womb is when the baby grows rapidly, and this is what we call organogenesis. This lays out the foundation for your child's growth. And we are going to look at your pregnancy in different stages and break it down to get a glimpse on what's important and when it's important. Yeah. So let's start off with planning a pregnancy, or what we call as a pre-pregnancy state. It's a good time to start and clearing up your habits before trying to have a baby. Now, if you notice, patients at different extremes of weight have trouble conceiving. It seems like a natural response of being unhealthy in our bodies preventing us from getting pregnant. So if you're overweight, you're going to be at a higher risk of having high blood pressure, diabetes, and things like polycystic ovarian syndrome, which indirectly prevents you from getting pregnant. Now speak to your doctors and they'll be able to advise you on how you can change your diet, and in fact, even start you on certain medications to jumpstart your ovaries again. So before getting pregnant, losing some weight or putting on some pounds may be actually beneficial. Starting a pregnancy on a heavier side of the scale can actually make pregnancies and deliveries more complicated, having more miscarriages and increased risk of blood clots. And did you know that, being slightly overweight or obese can cause deformities in the baby's brain development? So the first trimester or the first 3 months of life is, remember we talked about organogenesis. Now, if you notice, most of patients during the first trimester or the first 3 months of life, they have some sort of a morning sickness. And so they are going to find it difficult to keep food and water down. So this usually goes and peaks at about 9 weeks, and about 90% of them by the first 3 months either get better and move on. But the first 3 months is going to be rather difficult because, I'm going to tell patients to try to drink as much as water as possible, but that sometimes can be a bit of a task. So what I will tell them is to eat small, frequent meals, dry meals, basically like biscuits and bread. That will help you through. Now, adding some ginger to your diet is a home remedy that actually is quite useful for you. And I would also ask them to cut back on milk and milk products. Now, so this is when having a balanced diet before you get pregnant can tide you over. But in certain severe cases, you need to speak to your doctors, where he might do a urine test for you to see how dehydrated you are, and you might require a hospital admission and some drips to go in and certain medications to calm you down. Now, during the first trimester, you'll notice that most patients will tend to lose some weight, which is quite normal because of the vomiting and you're not able to consume so much of food. But this is interesting, the reason why you actually lose the weight and you have all this vomiting is because of a hormone that your baby produces called a HCG. And some guys, very interesting fact, they've decided to go and do some research on this, and they use synthetic HCG hormones to actually help patients to lose some weight. And they use, of course, a lower dose. That's something new that they have started off. Now, the second and third trimester is when moms are happier. And this is when the weight gain happens. In some cases, patients end up putting on an excess of weight. But of course, there are a few patients that actually lose some weight during the pregnancy, but those are few individuals. Now, most of us know what's good and what's bad. It is that some of us just don't want to know, don't want to follow. Now, carbohydrates or even junk food and processed food, they taste really good. So, and it's very addictive. And I'm sure most of you must have noticed, this thing called a comfort food. Most of it is carbohydrate based. So then you're going to ask yourself, what can I eat and what I cannot eat? Now, this is just a rough guide on what you can and cannot eat. And if you look at it, clean, healthy food doesn't really have to be boring or tasteless. You just need to work your way around it. Of course, caffeine, alcohol, raw food, and even fish filled with mercury and stuff are best avoided. Of course, there are certain conditions during your pregnancy that will need extra special attention. Now, diabetes in Southeast Asia and in Malaysia, you'll find this is a very predominant condition. Well, partially diabetes is a genetic factor giving rise to less insulin in our body, but majority of the cases or majority of patients are because there's an excess use of insulin because of too much food. So on a day-to-day basis, because you're using so much of insulin, at some point your insulin will be depleted. Now, insulin is produced by an organ in the body called the pancreas, and it really depends on how much you use per day. The more we use, the faster our reserves finish. Now, in pregnancy, it's slightly special because your baby will start producing hormones as it grows. So you will tend to have more sugars being released in your body. Excuse me. Now, so what we eat will significantly contribute to these rising levels. You need to speak to your doctors, and certain patients will require sugar tests to be done in order to figure out whether you are diabetic or not. So if you are at a higher risk, then the doctors will order these tests for you. And if you're diabetic, then he will ask you to change your diet, or what we call as diet modification, or in fact, even start you on, thank you very much, on medications to calm your sugars down. Now, these diet modifications are not really that difficult. In the beginning, it may be difficult, but after a while, you tend to get used to this. Now, one of the most frequent questions I get asked from my patients are fruits. They ask me, what about fruits and pregnancy? It's a very simple thing. If the fruits that you are consuming, are they sweet? And if it's sweet, probably it tastes better. And though it's natural, it's going to get your sugar levels to go up. And I'm sure a lot of people not very sure, not aware of this, but even avocado is a fruit, but it's not very sweet. So you need to see what you're having in order to make sure you keep your sugar levels down. In fact, I know people who have actually told me that they indulge in this orange drinks that comes in packages, and they say because it's vitamin C, it's good for you, and they have it every day, but not realizing most of it is filled with sugars. And you may be happy with the vitamin C inside, but the sugars are the one that's going to cause a lot of problems later on in life. Now, this is what most people want to eat. We Malaysians love this kind of food. And I'm not saying that, I'll be honest with you, even I on and off do indulge in these kind of things, but it's very rare. In a rare instance, I will go and have this. So in my family, every time we go to the airport, we always have these burgers and stuff because it's available there. It's like, and we go to the airport maybe once or twice a year. So if you have this every other day, then you're going to be running into trouble, right? Okay, now I can only say wow to this now. I'm going to tell you all a small story. I know a pregnant lady. One day when I got home, she was sitting on the dining table with 10 fingers, and she had chisels on her fingers. Now, chisels is a junk food which is shaped like a donut, so you can put it into your fingers. So she had them in all 10 fingers, and she was practically devouring it. And I just sat there and I kept quiet, because if I'd said anything, then I would have been in so much of trouble or ending up sleeping in the hall for the next few days. Now, and you guys are wondering, you're talking about it now. I'm not here trying to test my faith when I go home today, but I am trying to tell you that even to the best, it can happen. So, even people who are doctors or people who are professionals, they too do indulge in this. So, it tastes good. So, So and some pregnant women will go through this period where they have a yearning for certain funny food, and this is called paika. It's quite a common thing. But for me, I would still think it's empty calories. Uh, I think we should try to stick to moderation. So instead of 10 fingers, maybe we just use for 2 or maximum 4 fingers. That will help. But she did tell me in one day, she will lose enough of weight so the whole thing can go all the way down. But, that's a topic on a different day. Now, in Malaysia, we are living in a food heaven. You can't deny that. I've lived in different countries, and nowhere can come close to what we have in Malaysia. Every state, and in some cases, every postcode has a different cuisine. From Penang to Kelantan, Johor to Sabah. And to sum it all up, I would just say, wow. But in pregnancy and as we grow older, we need to keep some check or bit in control on what we consume. If you have an excess of this, you run the risk of having serious medical conditions. I'm sure all of us would have probably read or heard what Tun Mahathir said some time ago on diet. So he says he eats enough and not to get full. And if the food tastes really good, then he's going to eat less. But I do agree nowadays a lot of Malaysians are trying to keep a healthier lifestyle. So they're trying to be healthy. So that's good. Now, next is supplements. You need to speak to your doctors when you're going to start taking them. Usually, if you're pregnant, the doctors will put you on supplements or iron tablets that are useful for you and your baby. But of course, there will be, I still get patients who come and tell me, listen, doctor, we're not going to take these supplements and these iron tablets because I read somewhere that if you take these iron tablets, your babies are going to become bigger and it's going to be difficult for you to deliver. Now, that's absurd and a whole lot of rubbish. But this is what certain people put up on social media in order to either scare people away from taking these pills or to get scared enough and try to buy their own products. And I assure you, these iron pills don't really make your baby grow big. Okay, then there's, of course, other things like different types of milk specifically targeted at pregnant women, ranging from powdered milk fortified with DHA or goat's milk with dates, etc. You need to read these labels and ask your doctors if it may contain too much sugar and if you really need them. Now, DHA pills are kind of supplements with omega-3 oils, which have been told to increase brain development and increase intelligence. But it is in no way a substitute for good nutrition and parenting skills to raise children. So that one you need to be aware of. Now, traditional medication. Now, this is a huge topic. I'm sure a lot of you guys have gone on highways, on roads, even coming from Klang to PJ. You'll find all these huge billboards on the sides of the road that tell you they have, advertising pills or powders or even placental extracts that make you fit, fair, fertile, and honestly, in some cases, fabulous. It seems like an easy answer. One pill, one sachet, and you're all good to go. And you'll get celebrities and entrepreneurs trying to sell them, and people do buy them. And many of these entrepreneurs, can be, very controversial in their thoughts. But it sells, I have actually, followed a few on Instagram, and I read how they sell. They are amazing how the way they sell all these products, and it's a fantastic marketing skill. But I don't know, does it really work? Some of it is quite dangerous out there. And the question would be, if it is so dangerous, why are they selling? Or how come no one stops them? But if you notice, that in medicine, if at all we were to start you on medications or a new surgical intervention or something different, it undergoes robust, extensive trials to see whether it works. And this is called evidence-based medicine. Now, these supplements that are being sold are actually reviewed by friends or people that they pay to put up reviews. And that generates selling power. So you really have to be careful on what you consume and what you buy. And if you notice, most of this, you can't just go to a shop and buy it. They actually are sold direct selling. So if you can probably get them in pasar malams, night markets. Or if you go to this, hypermarkets, you'll find them in small little stalls in between the alley where you're walking, and suddenly there's one shop that crops up, and they sell all sorts of different products. So, I mean, I would think just you have to really look at the labels before you buy them. Finally, where do we go from here? I mean, the question would be, what do I eat? So I would definitely suggest, well, you need to do some research on things that you're going to eat. In pregnancy nowadays, there are a lot of books available, or those who don't like books, you can go online and you can read up stuff. But once you get enough of information, I would really suggest that you need to speak to your friendly doctors and ask them which is okay for you to consume and which is not. And I still feel, you should make an effort to try to eat well, because the long-term effects on a healthier lifestyle is enormous. Plan your pregnancies early, and for those men or husbands who want to start living a healthier lifestyle or lose weight and stuff like that, please feel free to speak to your doctor, or even come to me when your wives are coming in, and then we can have a little chat, and then we can take you from there. I've been toying with this, all this diet and stuff, not only for my patients, but even for myself, to see whether it really works. And some of it really works. So you just need to be a bit more careful what's out there. Any questions?
That was amazing, Dato. It was such a fun presentation, especially the finger part.
Let's sleep in the
How
hall
can you
today.
start a packet and not finish it and go only 3 fingers? So it's difficult. But as you say, take it in moderation.
Yeah, it is addictive. I mean,
Yeah.
supering whichever.
Okay. I can see we already have some questions up. Let's see the first question. It's from Mr. Kalong. Are babies of obese mothers will be more likely to be obese themselves in later life?
Okay, well, I feel, if you're being overweight and you're living in that environment, generally, the child that you're caring for and growing up in your house will tend to eat a bit more than you. So they will actually look up and see what the parents eat, and generally, or most of the time, you find, thinner parents having thinner children, or bigger parents having bigger children. So it really depends on how you look after them. Of course, genetically, if you are predisposed to be slightly bigger, then yes, generally you would have bigger children. But it's quite hard to say. It does not just follow because you are big and then your child is going to be big. I've had a lot of patients who tell me, listen, I don't eat so much and I'm still this big. Finally, at the end of the day, see what you put inside. So if you're going to live in an environment filled with food, your fridge is always filled with processed food, then generally you're going to have bigger children, that's for sure.
Okay. I read this quote. It says the best way to keep your baby healthy is to keep yourself healthy. So, and I think, as you said, when the husband comes to talk about healthy food and all, in that way, they are also being a support to the wife.
Right.
To be healthy, because if the wife is planning to eat healthy and the husband indulges in all the unhealthy food, so it's not going to help. I don't think so.
Definitely not.
Yeah. Okay. Let's go to the next question. It's from Miss Rachael. Are there any nutritional concerns for women having closely spaced pregnancies?
Okay, so now what happens when you have babies very often or too close apart? Now, because you've not actually recovered from one pregnancy, so you're going to tend to be depleted of certain, even things like iron and other nutritional stuff. So, well, then you're going to have to add a little bit. So I find patients with post-spacing or children every year, they tend to be depleted of iron, so they're going to be a bit low in hemoglobin, and they're going to be slightly pale. So those patients will probably definitely require a bit more help. And I think the spaced pregnancy again is something you really need to speak to your doctor, because I don't think it's really healthy having babies so close apart unless you're getting older and then you're trying to finish up your family. And but in no way, looking after a child is already a task, and we have two within the first 2 years. Yeah, that's going to be difficult. Where food is concerned, well, again, you're going to start off from the basics, and for those kind of patients, I would definitely add iron tablets and see how they are coping with that.
And when it comes to term of delivery, cesarean you must have at least 2 years apart, if I'm not mistaken.
The studies have shown that you need to be at least 18 months before you conceive again in order to have a stronger wound at the bottom where they've done a Caesar for you. And of course, that's one thing. The other thing is, again, one is nutrition. Next thing is you're not going to be able to cope if children too soon apart.
Yeah, that's
Especially
true.
after C-section, you're still covering, and then you get pregnant again. That's going to be a bit of a task looking after 2 children.
Even 4 years apart, you can feel the pressure.
Yeah, 3 years, I think is okay. 4 years, yeah, but too soon, oh God, is
Okay. Next from Mr. Sharul is durian safe? I love this question.
Okay, so I came up with this slide earlier about fruits and pregnancy, and in fact even diabetes and stuff. Of course, there are a lot of things about fruits that traditionally or legend says that things like, forget about durian, they were talking about pineapples and having risk of miscarriages and stuff because of the thorns that's available. I don't that one has not been proven. It's not evidence-based medicine now. Durians are very sweet fruit. So if you are diabetic, having too many durians is going to cause your sugars to definitely go up. Safe as in what? Going to cause miscarriages and things like that. No, that's got nothing to do with durians. I've also heard of this thing called, if you have durians, you get heaty. I don't really know what that means, but I only know it is sweet, and some people just can't. I can't stand durian, so it makes you burp all the time. But whether it's safe during pregnancy, I think it's from what we know, it's safe. But for diabetic patients, it's going to cause your sugars to go up.
But as you say, anything taking moderate.
Moderate, yeah, 2 fingers.
But I think, like myself, I do come from a culture where heaty and cold food,
Yeah, I mean, there's a small entity to that, but not in medicine. It's not evidence-based.
So anything you can, as long as you stay close to your...
Everything, moderation.
Okay, yeah, in moderation.
I think,
correct.
yeah.
Okay, so the next question is from Ms. Tia. Do vegetarian or vegan diets support healthy birth weights and pregnancy outcomes?
Okay, now there's a huge population who are vegetarians. I mean, it's a belief that they are, it's religious. So I mean, of course, we know that vegetarians will have limited certain minerals in their body, and that can be countered by taking some vitamin pills and stuff. But even among the vegetarians, there are a few vegetarians who are very extreme. So it's quite hard to say. But if you're vegetarian, then they will do blood tests for you and to see whether you are anemic, and probably having to add certain extra minerals for you. See, like things like iron, you do get them in spinach and stuff, but most of the quantities come from things like liver or meat. So this is where you might be a bit restricted. And the other thing about vegetarians are, because vegetarians, they try to compensate by taking other processed food and more of carbohydrates and stuff. So that might actually increase your sugars to a certain extent. But minerals wise, I think you should be okay. And birth weights, I've seen it doesn't really cause too much of a decreased birth weight or increased birth weight. Pregnancy outcomes pretty much the same. It's just that you run the risk of having a little bit of lower blood counts. That's all. But that can be addressed.
Okay. Thank you very much, Mr. The next question is from Hannem. Why am I losing weight in my first trimester?
Okay, so I discussed this in the first few slides. In the first trimester, about 90% of women will have some form of morning sickness. So you are not going to be able to keep your food and water down. You're going to throw up a bit more. And this is due to the HCG, or the hormones that the baby is producing. Since I told you in the beginning that, this vomiting and nausea feeling or morning sickness will be peaking at about 9 weeks. By the 3rd month, you tend to get better. Now, because you're not eating and not drinking so much, that's when you end up losing some weight. And remember, I told you, interestingly, this was a basis on how they use the same HCG to treat bigger or fat people in their clinics to try to lose some weight. So they use the similar HCG in a lower count to just inject a little bit into the patients, and then they tend to end up losing weight. So the weight loss in the first trimester is quite common. You will gain it back, especially in the second and third trimester. Not to be too worried. The only thing we're worried about is if you are too dehydrated. That's all.
So stay hydrated.
Stay hydrated, and if you can't, see your doctor.
Okay. Next is from Ms. Dam Suk Yi. Is it true if having severe gastritis at 28 weeks pregnancy now can trigger contraction and result in preterm delivery?
Okay, gastritis, you definitely need to see a doctor first, because there's two things. Either it's gastritis or what we call reflux, where because the womb grows so much and it presses onto your stomach, and then you feel acid coming out. Now, any chronic condition that makes you ill definitely does, have a certain impact on you having a preterm delivery. And of course, yes, it can trigger contractions. Forget about gastritis. Anything, even if you're too stressed and stuff, and you're working in an environment that you're not happy to be in, and too much work, also do cause some form of contractions and trigger preterm deliveries. But as I said, anything can cause this. So you definitely need to see a doctor. If the gastritis is so bad and it's going to cause you to start bleeding inside, of course, you're going to go and have a lot of complications with this. So, so you need to speak to someone and come in and have a chat with somebody. Of course, sometimes gastritis is because of what you're consuming at home too. So you need to watch that.
Okay. The next question is from Kevin Hu. Hi, doctor. If a mother having a twin fetuses, she needs to eat as usual, one person portion or more. Actually, this is quite a common question.
Yeah.
They say eat for two. Is it?
Okay, so now being pregnant doesn't mean you need to eat for two. You just eat, as I said, moderate, healthy diet. A lot of times patients do tend to feel a bit more hungry because, of course, their nutrition is divided some into the baby. But doesn't mean you really need to eat for two. I mean, I've known people who have put on 40 kilos throughout their pregnancy, and the baby comes out at 3.1 kilo. And the rest of the kilograms, I don't know where they have gone. But, when you put on so much weight, and then, you have the notion that you have to eat more because you have twins or triplets or even pregnant for one, you're going to end up having extra weight, and that's going to cause a lot of issues for you. Being bigger when you're pregnant, too many issues, including, the whole pregnancy can be complicated, and even the delivery process. So again, stick to moderation. That's all you need to do. Don't eat for 2 or 3. You don't eat for your husband.
So if you eat for 2, which means you're eating for yourself, that too, not for the baby.
Yes, it's not really. The baby, honestly, there are some patients who actually lose weight when they are pregnant, and nothing happened. The baby still continues to grow,
Yes, I've seen it.
So you don't really have to eat that much now,
Okay, so just eat as usual.
Yes.
Right? Okay. How do I know my baby is getting enough supplements?
Okay, the baby works the baby is in a very special environment. Whether you eat or not, the baby is going to get whatever nutrition from you, that is from the placenta. Now, of course, if the baby is not growing enough, then the doctors would be able to tell you by looking at your cord, looking at how the baby is growing, and looking at the blood flow that goes from the placenta into the baby. Whether that's caused by supplements or not is quite hard to say. But of course, there are certain conditions that make this kind of blood flow less. It's got nothing to do with supplements. In those kind of conditions, certain patients will be put on types of medications called aspirin to just increase it. Otherwise, you should be okay. Whether enough of supplement is going in, you don't have to worry. I think most patients, unless you are living in a rural place with no food, then you're going to have some trouble.
Okay, I think there's no more questions, but if there's any other questions, please post it on the comment section, and we will surely answer that later in the comment section. And then, Dato, is there anything, any take-home message you want to give to all these pregnant mothers, or who wants to be pregnant, or trying to get pregnant?
I think it starts off with planning. You need to plan what you want to do. If you're planning to have, of course, life doesn't work so planned out in that sense. But if you're thinking of starting a family, then you need to start looking at how you are living before you start having trying to get a baby and things, and making sure that you are in a healthier state. So that is why A lot of times we would advise you to go and meet your doctor in a pre-pregnancy clinic just to speak to them and then try to live healthily. Remember, just stick to moderation. If anything that you do, and I think you'll be okay. And you need to ensure that you have someone that you can communicate with, your GP, your doctors, in order to ensure a safe and healthy outcome.
Okay. Thank you so much.
Thank you.
For those who want to know the details of doctor's clinic session, we will post it up later at the end of the session. Thank you so much for joining, and make sure you all like and share this video with your friends. We might not know who might need it.
Yes.
Someone needs to know about pregnancy and nutrition. Okay, thank you so much. See you all in the next time.
10 fingers.
Bye.
Bye.
10 fingers.